Now, all surgeries, including cosmetic procedures, carry risks, and those with a history of cardiovascular disease, lung disease, diabetes, or obesity have a higher risk of developing complications such as pneumonia, stroke, heart attack, or blood clots in the legs or lungs. Now, how do you lower the risk of these complications in your patients?
Well, so the most important thing is, because this is what's called an elective surgery, you want to mitigate as many of those risk factors as possible. So I think it's really important to have good communications with your primary care physician. So if you're a smoker, obviously you need to stop smoking, and the recommendation by the American Society of Plastic Surgery is at least 4 weeks before surgery and at least 2 to 4 weeks after surgery to make sure there's no healing complications. If you're a diabetic and your glucose is poorly controlled, they want you, what's called your hemoglobin A1C, to be less than 7. Obviously, the lower it is, the better. And what I recommend to all my patients that before surgery, make sure that you can exercise and be healthy and be as active as possible.
But who's not a good candidate? Would you say someone with heart disease or some of these that we read before who've had a history of strokes or diabetes should not be getting breast augmentation?
I would say it's variable. Every surgeon's a little bit different based, again, on what kind of risk they're willing to take. Most people who come seeking breast augmentations falls in their 20s and 30s and are usually relatively healthy. But, it's sort of, you have to really talk to your patients and make sure that whatever health problems they have isn't big enough that it can cause something that's irreversible. My mentor, when I was training, had this great saying for me. As a surgeon, your patients come into the door, walk into you, and you want to make sure that it's your goal that when they walk out, they're better off than they were before they came to see you.